when I just was trying to figure out where to get my MPH, I knew I wanted to do sexual violence prevention. Mm-hmm. And because there's so few people doing that work, I picked where I applied based on how I could do that. Like, was there faculty doing anything remotely like that? So I went to Emory and got my MPH there. And when I was there, I really carved my path. Mm. I did so much research on, okay, which class can I get some knowledge on violence prevention? I'd even look at the syllabi and be like, what are the assignments? Could I do this assignment on sexual violence prevention? And one of the classes had guest speakers, and I saw that one of them was one of the leading sexual violence researchers at the CDC. So I took the class just to have her speak. And then afterwards, I was like, I need to do my thesis with you. And I was persistent, very professionally persistent. She was very kind. I got her email. She's very busy. I emailed her multiple times and I kept following up. And eventually she's like, okay.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health. From the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Marissa, welcome to the Public Health Insight Podcast.
Thanks for having me. I am so excited. I know we've been talking about this, trying to get this on the books for a while, so I'm really happy to be here.
Right, and we've never had an episode where we exclusively focused on burnout as a concept, and burnout specifically, not for the health system or healthcare workers broadly, but you're talking specifically about public health burnout. But before you are the Marissa that sits across virtually from me today, you were a student, you were exploring your career, and there's lots of different formative experiences you must have had before becoming the person that you are now. So I want to go back down memory lane. I like to use the analogy of a Google Maps. You have a starting point, a destination. You might run into traffic. Google's telling you to turn left, turn right, exit. There's a stop sign. So there's lots of unexpected things that happen on your journey. But I want to catapult you back to the days of when you're transitioning from high school into your bachelor's program, right? But then I'm going to do something different and skip that and then come back in reverse because you did something really interesting. You have a master's of public health. But before that, you had a Bachelor of Science in public health as well. So it's not often that I meet someone that has an undergrad in public health and a master in public health. Public health tends to be something that's discovered after someone starts a bachelor's degree. So from that transition from high school to your bachelor's, knowing, or how did you even learn about public health? And then what made you specifically choose that over the nursing, the doctor, the more traditional health roles?
Yeah, I think now it's more common there are undergrad degrees in public health, which I'm so happy about. But when I was in college, that wasn't the case. I think I just got lucky. So like many others, I wanted to be a doctor. I knew I wanted to help people. And then I went to summer camp at UC Berkeley for aspiring high schoolers who want to be doctors. And that's where I learned I don't want to be a doctor. I still want to help people. But the med students were like, we have no life. We study 24/7. And I was like, nope. I already knew at that young of an age, I wanted to do good work in the world, but I was not going to sacrifice everything for it. So then it was like, okay, what else? Nursing. So I went to University of Arizona, planning to go into nursing. The way it's set up there is you do your freshman, sophomore year, and then you apply to nursing school for junior, senior year. And I did not, I applied twice and I didn't get in. And I had taken a undergrad class in HIV prevention. And I remember I loved that class. And I even told my mom, I love this thing called public health. I think I want to do this. And in her mind, right, my parents, neither of them have a college degree, right? They're both what we might call working class. My mom worked at the casino as a blackjack dealer. My dad was a janitor. So to them, they're like, no, you want to go into nursing. That's steady. That's great pay.
Tangible,
right?
specific.
Yeah. And what people knew about public health then was just you give STD vaccines, right? Or treatment. That's kind of all they knew. But then when I got rejected from nursing school, I went and did a leave of absence and did HIV prevention work in Tanzania. And that's when I was like, oh, no, I'm going to do this public health thing. And I was very fortunate that the University of Arizona had an undergraduate degree in public health. It was one of the very few back then. And so I think it was by luck that my college I was already at had that degree, and I was able to do that as an undergrad. But now it's much more available and people are seeing the value of it, because even if someone goes into pharmaceuticals or becomes a doctor or a nurse or whatnot, to have that public health foundation is really useful.
So it sounds like that HIV prevention course had a really profound impact. What kinds of things did they talk about in that course? Because not only did you go in public health more generally, you talked about that HIV prevention experience in Tanzania. So that course kind of drove in some way a lot of those decisions. So what types of things did they talk about in that course?
Yeah, that course, it was such a good, when I look back at it now with all my public health knowledge, such a good course, because it didn't just talk about HIV from an infectious disease standpoint. It talked about the stigma. Okay. It talked about the discrimination and how that played into a lack of prevention, a lack of treatment, right? It really talked about the social determinants of health without calling it that. And our professor, I forget who it was, of course, but I remember the impact and how he really humanized the story of the communities who were impacted. And I remember thinking like, wow, like if this had just been prevented, right? If people had taken it more seriously, if they didn't discriminate, right? The spread of it would have been much different, which we do know being in public health. But at that time, I didn't have any concept of public health.
Right.
So to me, it was really mind blowing to think of that. Like, wow, you can impact so many more people on the prevention side than just treating one patient. Although that's important. I don't want to diminish the importance of that. And we know, of course, the levels of prevention. So treatment is a level of prevention. But yeah, that had a big impact. And then when I went to Tanzania, I had some big lessons of my own, grappling with what does it mean being an American doing this work in another country. Even though I'm Arab, right, I present white. So what does it mean as a white person in Tanzania doing this work? And once I went on to grad school, I really continued to grapple with that and had conversations with my advisors and other students about that. So my kind of thinking around public health really started to get more complex and grow, but it did start with that experience in HIV prevention.
So you talked about going to grad school. Some people also will do their undergrad and then go straight to grad school. It seems like you did have some work experience in between. So for someone who is so sure about public health, why not go straight into doing your master's right after your undergrad? What was that decision like in that period of your life?
Yeah, and I would say anyone who is kind of in undergrad and wants to go to grad school, I would encourage work experience. We'll probably talk about later. I later on went and became a director of an MPH program. Right. And we saw a lot of students come in without that work experience, and it actually really hurts you in your graduate program. And I can talk about that later. But for me at the time, to be quite honest, being the first in my family to even go to college, the idea of going to grad school felt so far. And so I was very lucky. I had some older classmates who went and applied and got into grad school. And so they were helping me. But it was almost like I didn't know how to go about it. And what I knew was how to get a job. Right? Coming from a working class family, I know how to get a job. I know how to work hard. And in public health, it's very hard to get a job without a master's degree in working in actual public health, which is a separate problem that we need to solve. But I ended up getting a job in social work, which I am so grateful for, because I was able to work directly with communities and see what we need to prevent. And I think part of the reason I really encourage people to get work experience is because if you don't have that direct experience with communities, when you're in school and when you then go to a health department or a federal agency, you don't really have the context to do the work as the best you can. And you are so far removed. And at least for me, I had that memory. I had that experience. And then when I was in grad school, I could use that for my assignments to think critically about the lessons we were learning, about asking questions of how does this actually apply in a real world context? Because in grad school, it can be taught very much like a petri dish situation. So I feel very lucky that it turned out I ended up going and working and having that experience and then going on to grad school. But hindsight 2020, I even think working a year or two longer would have benefited me so much more.
Interesting.
And then getting my master's.
Did you know throughout all those years in between that you would always do specifically a Master of Public Health? Or was that open to other pathways? Like some people do MBA because they want to have more health administration, and MPA, different types of masters that could supplement your undergrad that you had in public health already. Did you always know that it would specifically be an MPH, even when you're working in those times?
So one of the things when I was in Tanzania that I saw was the domestic violence there. And as a woman, right, even before I went to Tanzania, I knew that women are at higher risk for domestic violence, sexual violence. So it was something as I started to learn about public health that my mind went to working in violence prevention. And when I got back from Tanzania, I started to work at a domestic violence shelter. And I worked with families, women, children who were leaving their abusive situation. And so I had this idea that maybe I'd go get my MPH and then get a PhD and then be a faculty member. Because what I learned, there were not a lot of people doing sexual violence prevention work. And there still isn't in public health. Even though violence prevention is a huge public health issue, whether it's domestic violence, gun violence, whatever it may be. And again, I think I was very lucky. The University of Arizona had a faculty member who was one of the leading researchers in sexual violence prevention. She created the kind of validated scale that most people still use to this day to measure sexual violence. So being in her class, I started to kind of think, maybe I could do what she does. This is where we get to representation, right? I would have never dreamed that with my experience growing up, right? My family background. But I was able to start dreaming that. And so that was my plan. Then I went and got my MPH, and about a year in, I was like, I can't do this for 10 years. No way. I see all the faculty. I see how stressed out they are. I see how much they're working. I see how much these students are stressed out. Our TAs were PhD, DRPH students. And I think that little piece in the back of me was like, this life of overworking and hustling and killing myself for a career, there's got to be another way. So I took that like PhD part off the table, but I still was like, I'm going to carve my own path and do this work and have an impact, just a different way. And I think when you're talking about the stop signs, the construction, that's kind of what it's like. It's not linear. You take your lessons and you figure out what works for you, and then you figure out how to do that. And sometimes you do have to carve your own path.
Having such a foundational base in public health from your undergrad, did it ever cross your mind about what else could I learn from an MPH? Because we have a lot of students actually that are like, I have a bachelor in public health. Should I do a master's in something else since I already have some foundational knowledge in public health? Were you hesitant at all about like, oh, how much more can I learn doing a master of public health? Or was it more like you knew you had to do graduate school to then get to the PhD because that was your goal at that time? Like, what did you have those types of internal struggles or conversations with mentors or people that you knew?
I didn't, because I saw it, and I think this is the way it is, right? Is every level of grad school, it's more specific. Okay. So undergrad is very general, but grad school, I was in the Department of Global Health. My track was sexual and reproductive health. Okay. And I got a graduate certificate in violence prevention. So I was able to see that I could specifically do what I was interested in. Gotcha. And then I knew at a PhD level, it's even more specific, right? So it's like one specific methodology or one specific kind of topic area. And I think that still is the way it is. So I also think once you're in your MPH, you do see not just topically, but the skills you get, right? Survey development, community assessment, sometimes leadership skills, depending on your program. But you get much deeper skills that really do help you more than you do in undergrad. Undergrad is just a bit more general. Right.
A little appetizer. Now, you mentioned you saw, PhD, not for me, but you still ended up in academia and leadership roles. From, obviously, you talked about the public health program. So can you talk more about why you ultimately made that decision? And then what was it like? Because I think we're getting towards, you witnessed some of your peers as students being stressed out. You witnessed some of the faculty and staff being stressed out in that environment, which leads us to eventually we'll talk about burnout, stress, and work-life balance and things like that. But how did you arrive in that space? So you went from HIV prevention to then I see myself molding the next generation of public health professionals. Where did that shift come about? Or did you see it as a shift? Maybe you didn't see it as a shift at all.
I do. When I just was trying to figure out where to get my MPH, I knew I wanted to do sexual violence prevention. And because there's so few people doing that work, I picked where I applied based on how I could do that. Like, was there faculty doing anything remotely like that? So I went to Emory and got my MPH there. And when I was there, I really carved my path. I did so much research on, okay, which class can I get some knowledge on violence prevention? I'd even look at the syllabi and be like, what are the assignments? Could I do this assignment on sexual violence prevention? And one of the classes had guest speakers, and I saw that one of them was one of the leading sexual violence researchers at the CDC. So I took the class just to have her speak. And then afterwards, I was like, I need to do my thesis with you. And I was persistent, very professionally persistent. She was very kind. I got her email. She's very busy. I emailed her multiple times and I kept following up. And eventually she's like, okay, I'll help you get data. And I did my thesis with her and I did my summer internship. And I eventually got a fellowship at the CDC in the Division of Violence Prevention because I had a clear vision. Now, I will say not everyone has a clear vision, and that's okay. You don't have to have it. I just happened to, and I was really persistent. And so at the CDC, I've led some sexual violence evaluation work. Like, how can we evaluate state and local interventions on sexual violence, especially knowing they don't have the resources to do data collection. So I looked at what public indicators can we use. I created some technical assistance. And when I was there as a fellow, me and a couple of my colleagues realized the professional development opportunities for fellows were really neglected. CDC does a really great job of providing professional development opportunities for their FTEs, but a lot of them fellows couldn't do, at least at the time. It might have changed, but some of the courses we couldn't take, some of the kind of shadowing opportunities, or they'd have placements you could do at the time we couldn't do. So we developed a professional development collective together. And I'm still proud to say it's still in existence today. It's so much bigger and stronger to help develop fellows and give them opportunities. And my plan at the time was to stay at the CDC, get an FTE, do sexual violence prevention work. And
Makes
then,
sense.
Yeah, right? Then life happened, right? Trump was elected, and pretty much everyone in sexual violence prevention was like, what's going to happen to our funding? Then my mom got unexpectedly ill. I got a call in the middle of the night. She's going in emergency surgery. She might not make it. And I had to fly home. And I took care of her for about 6 months during her recovery. And I was very fortunate to be able to finish my fellowship remotely. But then it was like, I need to stay on the West Coast. So I had to pivot, right? I still tried to find sexual violence prevention jobs. There weren't a lot of places where like, we're not hiring because we don't know what's going to happen with this new administration. So it was a pivot, and it was, okay, what can I do with my skill sets? And what I ended up at UC Berkeley because they had the Center of Excellence. They still do. It's funded by the Maternal and Child Health Bureau. It's a training center. So I was like, okay, I've done a lot of workforce development, right? That's what I basically did from the ground up at CDC on the side of my evaluation work. I've done a lot of evaluation work. That's part of running a center, and a grant-funded center. You have to report, you have to evaluate. So I applied. I was like, my skill sets apply. I might not have all the knowledge about maternal and child health, but I know I can run this center. I know I can run this grant. And I got the job, and I learned more about maternal and child health. I already knew about reproductive health. So it worked out that way. Sometimes you just have to pivot because life happens. And looking back, I now see how happy and thankful I am that I had that pivot and all I learned through that and where it led me to now. But sometimes when you're in the pivot, it doesn't feel that way.
I can relate to that. I had always been like infectious disease. And then you realize those roles are usually reserved for clinicians because regulated health provider talking about infectious disease spread and that kind of thing. And I recognize that maybe that's not a space that I could can make a name for myself, so to speak. So I pivoted to chronic diseases and mental health because there was more of an appreciation for different skill sets there. So I definitely understand where you're coming from. And I know you said vision, and it probably a little bit of it is vision, but in hearing how you speak on things, it's a lot about knowing how to go for what you want at the time that you want it, if that makes sense. So I don't want people to say, well, I can't identify with Marissa because Marissa, they had a big, like, that might be true, but it's like Marissa said, I want to get into violence and sexual assault prevention. There's a speaker here. I'm going to send 100 emails till I get what I want.
Not 100.
So, 100, 1,000, 1,000, 2,000. Just kidding. I think there's something to be said about respectful persistence or something like that. Professional persistent. Yeah. So I think that's one of the takeaways for me. Now, how long were you in that role? So you went to that center for maternal and child health. How long were you in that role? What types of things did you learn? And then how were you planning sort of the next steps of your career as you were kind of working your way through that role?
Yeah, so I was there in that role for 3 years. And to put some context into it, right? I was going into that role after my mom basically almost died and I had to take care of her, right? I moved across the country. I went through a breakup and I was going into an organization at the time that just went off a bunch of layoffs, like before I came in, about a year before. So the role I was doing had 2 other sub roles that I had to take over that used to be other staff. So I was coming into an organization where the staff who were still there were really burnt out and really bitter. The leadership at the time, people felt like weren't listening, were giving lip service, and there was a lot of external challenges. So I had this work challenge and then I had my personal challenge, right? And what happened was I hit burnout. I hit burnout in 2017 before people called it that, right? Before it was talked about. And I was exhausted. I remember there was one Sunday I'll never forget. I was like outside, the Bay Area is great weather year round, playing with my dog. And I get a notification on my phone, an email. I'm not in trouble. It's not urgent. But I just start crying from the sheer exhaustion. And
so just a benign email, like just,
yes.
Wow.
So what I didn't know then, which I know now, is one of the signs of burnout is a disproportionate emotional reaction to small things. So that was happening, right? It was a benign email, but like my emotional reaction was like as if I was getting in trouble, right? I was crying, I was overwhelmed. And we can talk more in depth about what I did about that and how I got out of that. But once I did get out of that, I stayed at UC Berkeley. And then I moved up to an executive director role at a different research center once I was out of burnout. But that's kind of, how that time at UC Berkeley started. It was definitely a shift in my personal experience about working in public health.
Gotcha.
Yeah.
Ready for some rapid fire questions?
Yes, let's do it.
All right. Welcome to our rapid fire segment called Insight Blitz, where I will ask you questions. I'll read some statements and you'll provide a brief response, the first thing or second thing that comes to your mind. Ready?
Okay.
What skill did you learn early in your career that you still use today?
Writing good surveys. Good survey questions.
I like that you said good difference. Because there are bad ones.
Yeah, good. Yeah. It makes a huge difference.
Yeah, for sure. A career path that you might have considered if not public health.
Being a medical examiner.
Medical examiner.
Like a forensic like the ones who like look at in coroner's office, like, dead bodies and figures out what happens to them.
So I thought, because early on I think medicine, like me, I was interested in becoming a medical doctor. Now medical examiner, that's very interesting. Why?
That's not what I thought when I was younger. But the older I've gotten, I'm like,
right. If you reevaluate,
it's like a fascinating puzzle, right? Like what happened? Like I just find it.
You find the story, right? You can build it.
Yeah.
Interesting.
Yeah.
Does that influence your choice of TV shows and movies that you like?
Oh, I do like true crime.
Okay.
But not too gory.
Okay,
right?
gotcha.
Yeah. I don't want to see the gore that happened before they'd come. Yeah.
Right, gotcha.
Yeah.
The next one, you're hosting a dinner party with your personal heroes. Who would those be at the table?
Okay. No pressure.
Could be
dead
anything.
Or alive? Can
Yeah,
they be dead?
any industry, any reason whatsoever.
Okay. I think I'd have to have on my dad's side, probably my great-great-grandfather who immigrated here from Lebanon. Or my great-grandfather. I can't do the math right now.
I'm bad at the family tree stuff too.
And then probably my maternal grandfather, just because hearing their stories and how they went through their challenges. Who else would I have? Let's see. Oh gosh, this is really... I'm a thinker, so rapid fire is not my best. But let's see, who else would I have there? Let's see. Michelle Obama would be really fun. I think that would be enjoyable.
You can't go wrong with Michelle Obama.
Yeah, I think that'd be really fun. Let's see. I'm a really big, I love cooking. So I think I'd have, Alex Garichelli, who's a big, well-known chef. She might be fun to have there. Let's see. Gosh. I'm trying to look at my books. It's one of the authors that I really admire. What else would I have there? Oh, Kid Cudi. My dog's named after him. I'd have to invite him.
Wow, that's an interesting...
I couldn't miss the chance.
That's a very interesting dinner party. Okay.
Yeah.
If that ever happens, you gotta tell me how it goes.
That would be fun, right?
Wow.
A former first lady, a chef, a rapper, and then my ancestors.
You gotta tell me how that goes. Even if it's like a dream or real life in some alternative reality.
About it tonight. Yeah.
Oh my gosh.
Yeah.
Speaking of dream, what is your dream destination to workcation or to work from?
Oh, to work from? One of my dreams is to have a second house, a cabin in the mountains. I'm from the mountains originally. To go up and just be in the trees and beautiful view. I would just love that.
All right. Point taken. This one, a hot take you have about public health.
Ooh. I have a lot. I love public health, which means I'm a big critic of it. I think what holds public health back... Well, can I give two?
Yeah.
Okay. I think there's two things that hold public health as a field back from making the impact it could. One is the resistance to change. Big time, whether it's in partnerships, in methodologies, in technologies, in workplace policies. And I think a huge disservice we do in public health is not teach public health professionals how to sell public health. We teach them how to communicate. That is not the same thing as selling. And we saw that firsthand in the pandemic. We communicated, but we did not sell the value, the importance of wearing a mask, of distancing, of vaccine. So I think we think of sales as a bad thing, but the skill of sales could really help public health communication.
You're not the first person I've heard talk about the marketing and sales like that. There's something to be said there. It'd be very powerful to have. Obviously, public health can't dream of, at the moment, paying people in those private sectors to come over and help us out with those things. But
they
can you imagine?
Be adjunct faculty teaching a course.
Yeah, can you imagine? That would be very powerful.
Students could do internships, right?
That'd be very powerful.
Yeah.
Okay, that's a good one.
Yeah.
Worst piece of advice you've ever gotten?
Oh, always say yes. That was the worst advice I've ever gotten. It leads to
that one
burnout.
jumped. That one jumped right off.
Leads to overworking, and it conveys this idea that every opportunity is the right opportunity for you. And what happens is, if you're saying yes to everything, you're saying no to other things that actually might be a better fit for you. That might be a better opportunity for you. So I think instead of saying yes to everything, it's about building the confidence to figuring out and saying yes to what's right for you and saying no to what's wrong for you.
Okay. Point taken. Lastly, your favorite way to decompress after a potentially stressful day?
I would say some physical movement. So going to workout class, I do Orange Theory, or walking my dog, getting outside of the house. Yeah, for me, that if I'm having a long jam-packed day, that's the best way to get rid of the brain fog, kind of separate my day, get into my body, have some endorphins running, reset.
Wonderful. So that brings us to the end of our Insight Blitz segment. How would you find that? Did you get more stressed out? Do you have to take a walk after that segment?
For someone who's a thinker, I'm going to continue to think about who I'd invite to my table. And I'm going to be like, I should have said this person. I should have said this person, like tomorrow.
I think you have a great table. And I think you can control how many seats are there. I think we landed on 4 or 5. So if you want to keep inviting people to the dinner, just make sure there's enough food and drinks. And let me know if you ever go into a dream state and that actually happens.
I will.
We can have a part 2 of like, how was that like? What did you talk about?
I'm gonna as I write them down in case any other podcast hosts ask me a similar question. Then I'll just pull out the paper and be like, I'm prepared this time.
Yeah, and then that follow-up question would be like, what did you talk about? What were the hot topics?
Then I'll be like, I don't know, jeez.
All right. That was fun. Got to learn a little bit more about you through that as well. So thanks for participating in that. And the elephant in the room. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.